Hey, how's it going? My name is Liz Smith, and I wanted to share a little story with you. I was a young woman, and in my early 20s, was a very ambitious person. I started my coaching career before I even finished college, and through that, I was coaching and teaching high school, and I was engaged, and I was 24 years old. And at my second year teaching, about 5 weeks into the year, I was diagnosed with almost stage 4 Hodgkin's lymphoma. And that is cancer of your lymph nodes, and it was in every lymph node. You have hundreds throughout your body. It was in every lymph node from the base of my brain to my belly button. Hundreds in between, with a double-fisted mass in my neck and a mass on the bottom of my left lung. And I had 6 months chemo, 6 weeks radiation, and fortunately were declared cancer-free after that, and my husband and I were married 8 weeks after that. So that is my background. And why does that have anything to do with chemical contraception is the next part of the story. I was put on the pill by my cancer doctor to not have children in the first few years after having chemotherapy, because that would be dangerous to the child. So being on the pill seemed like the logical solution to him, and I honestly didn't know any better. So that's what we did. There are those that want to talk about the religious side of the pill, and I get that. I totally get that. But for me, it was a scientific need, and it was a reason to take it, so I felt justified in why I took it. Well, after a few years, we did have a child, and we did not get back on the pill, but I was re-diagnosed with cancer again. And the only link they had to my cancer coming back, because Hodgkin's has been cured for decades. It's considered a very curable form of cancer, that it doesn't normally come back, and especially it doesn't come back in the same original places where you had it. It usually comes back as breast cancer, as a side effect of your chemotherapy through your liver and other things. But mine was in the exact 3 same spots it had been originally, and that was highly concerning to the doctors. I do have to say that I had a miraculous experience from that. So the second time I had cancer, I had an overnight miracle. But again, we're back on the topic of birth control. The only link they had to my cancer coming back was that I had taken the pill. And the pill, obviously, I didn't understand what all was going on. I knew I didn't want to take it again because of my family members had started to talk to me about, maybe why you shouldn't be taking this, and don't it says in there that there's a cancer risk. Well, my oncologist is the one who'd given me the pill, so I hadn't really questioned all of that until I started to really read the literature. And sure enough, you look right in the literature and it says, don't ever take this if you've ever had cancer. And one of the major side effects of this is blood clot, cancer, deep vein thrombosis, stroke, all of the things that can go wrong taking the pill. So my initial investigation into not taking the pill was, why was I put on it in the first place? And the more that I looked at it, the more I became associated with people who really knew what they were talking about, and pointed me toward the right books and the right information to learn about the pill. So I think there's a couple of main points here, and one of the main reasons, I don't think everybody's going to have cancer from having taken the pill. However, when you look at the research, you are not given the full picture from the advertisements and from even the doctors that are prescribing it to you. There's not a full explanation of the benefits versus the risk. If there were, it would be much less prescribed and for much shorter periods of time. So I thought I would take 2 seconds and show you how easy it is to understand why the pill might not be your best choice for your health. Religious experiences and religious reasons, are they there? Moral reasons? Absolutely. And there are some that I didn't even realize when I started exploring this, but my whole interaction was on the scientific side of it. Should this be given to women or should it not? So if you can indulge me for just a quick minute, hopefully I can explain it to you. Your body has a balance, and we've heard it called hormone balance before. Well, it's really quite simple. It's not too difficult to understand, although they make it this big old mystery. Your body needs to be in harmony and balance. Well, what does that mean? Basically, you have a few hormones that are made in your body, and the main ones that we're talking about with hormone balance are estrogen and progesterone. Your estrogen and progesterone are made because you have a female cycle, and in layman's terms, days 1 through 30 A woman is never the same on any given day. However, you make estrogen every day until you hit menopause. And that estrogen is made in tiny, tiny amounts called picograms. And picograms, the best way I can give a visual of this is if you were to sprinkle salt on your food. You don't dump the salt on your food. You sprinkle just a little bit when you eat salt. And that's how little your body makes estrogen. A very little bit goes a long way. A picogram size of estrogen every day until you hit menopause, you have that steady source of estrogen. If you have a cycle, if you have a period, you have estrogen and you have enough of it. Then the other side of it is the other hormone that's made that keeps your body in balance is called progesterone. And progesterone is made only from mid-cycle to the end of your cycle, meaning days 16 to 28, whenever you have ovulated. When you ovulate, that if you've seen the picture of the two ovaries, when the ovum is released, you have this funny looking flower thing in the ovary, and that is called the corpus luteum, and it produces progesterone. But when it produces progesterone for even that half of the cycle, it produces it in milligrams. So you're making picograms, little tiny sprinkling of salt of estrogen every day, and then you are making milligrams, 20 milligrams a day of progesterone, and that's what creates the balance. But if you're looking at the two sides of the scale, estrogen is making this little sprinkling every day. The progesterone side is making what you would look at as the entire Morton salt container of progesterone, and that's how it stays in balance, is this big old dose of progesterone versus this tiny sprinkling of estrogen. So imagine if you double the sprinkling, if you give yourself a double dose of estrogen through toxins in your environment, through things that are absorbed through your skin, through the pesticides, herbicides in your food, water sources, all of the things that in our society are toxic, 90% of them act as estrogen on a woman's body, increasing our estrogen amount through what's called xenoestrogens. If you double this side, you have to double this side. So you've taken one Morton salt container, stacked it on top of another Morton salt container, and that is the difference. That is the amount difference of what your body makes. Now, if you get on the pill, if you get on a chemical contraceptive, an IUD, the patch, pill, insert, Depo-Provera, all of those give you not only fake hormone that messes with that balance, but they are shutting down your ovaries. They are keeping you from ovulating, which keeps you from producing that progesterone that protects you. Whenever you have excess estrogen and not enough progesterone, whether that's you've doubled your estrogen or you have squashed your progesterone through a progesterone squashing supplement such as taking a pill, or because you are stressed, we live in such a high stress environment, most women are not even ovulating every day. That when you squash that level of progesterone or increase the estrogen or both, you put your body in a state of imbalance. And that imbalance comes out as PCOS, PMDD, PMS, acne, weight gain, anger, chin hair. It comes out in all of these crazy ways. Most women, when they go into their doctor and they say, these are my symptoms, they are put on antidepressants, when what they should be checked for is their estrogen and progesterone levels. And even then, doctors aren't always testing it the way that will show what is free and available hormone in your body. They'll test the wrong side of the blood. So you have to make sure that your practitioner is testing for free and available hormone. That's usually with the saliva test or with a serum blood test, and that tests the correct part of the blood that tells you if you have enough available hormone. Plus, remember we said day 1 through day 30, every day is different on your cycle. There are going to be different levels at the beginning of your cycle than there are mid-cycle and end because of that progesterone being produced in that large amount. And so you need a whole profile of when and how that all looks.